that by sending SMS on the numbers that will be scrolled on your screen shortly, or interact with us via our social media platforms on Facebook, on Instagram, on Twitter, using the hashtag Galaxy Today. It is a pleasure to
introduce our guest this morning. Of course, we're having the doctor from Ibadan, but right here in the studio we have Dr. Folajimi Adebowale, Clinical Coordinator, World Plus Care Clinic in Magodo here in Lagos. Good morning, sir.
Good morning. How are you? It's nice being here once again.
Yeah, nice to see you.
First time this year.
Oh, yes. Okay, yes. So it's Happy New Year.
Same to you.
All right. I mean, okay, as a woman now, you get to the clinic, you give birth, and then the next thing they say is watch this child for a couple of days. They want to suspect, they want to find out if it's jaundice. And locally, you find women who feels like if a child has jaundice or not, you bring them out first thing in the morning under the sun to see, probably to cure or to prevent just the jaundice or whatever. But a couple of people mistake jaundice for hepatitis B. But I'd like us to go back to the root. What exactly is jaundice?
Okay, first of all, jaundice could occur both in children and in adults.
Okay.
It has to do with the liver.
Okay.
Primarily, jaundice is a waste product from broken down red blood cells. When iron is taken away from red blood cells, the bilirubin, there's a product called bilirubin, it goes into the liver. There's a process that goes on there, and it comes out through the feces eventually. In fact, the whole process is why feces have a brown color.
Okay.
You understand? But if for any reason in the process, maybe before the process, in the middle of the process, or after the process, if anything goes wrong, you have this buildup of bilirubin in the bloodstream, which gives a yellowish tinge to the skin and to the sclera, which is the white of the eye, which is popularly called jaundice. For different reasons, it occurs in children, and for certain reasons also, it occurs in adults. Now, basically for children, there's what we call the physiologic jaundice, and there's what we call the pathologic jaundice. Now, when a child is in the womb, before child begins to breathe air, the child has a very high level of red blood cells. Okay. And the moment the baby begins to breathe air, he or she doesn't need that amount anymore. So a lot of that red blood cell has to go to waste. So many red blood cells are now broken down, and the new, immature liver that has not really done anything before has this burden to break them down. So there's possibility that, maybe on the third or the fourth day of life, there could be slight, yellowness in the eye or the skin of the baby. That is the physiologic jaundice. It comes, it goes, there's no problem with that. But if for certain reason, possibly a child develops fever just after birth, or the child had a difficult labor and had to have active resuscitation, or the child is even premature, you understand, these processes cause the breakdown of red blood cells to be very rapid. So the liver is just meeting this very huge burden of bilirubin it has to clear, it cannot clear. For example, if you see jaundice within 24 hours of birth, it is most likely not a good jaundice. You would need to, take some action to get rid of that jaundice. That is a pathologic jaundice.
So invariably, clearly there is some good jaundice and some bad jaundice.
I won't call them good jaundice. I won't call them good jaundice. I could call them jaundice that will go by itself. Okay. Expected jaundice that would, clear by itself. And there's
a jaundice for how many days, or what's the duration it takes?
It depends. It varies. Within a week, within 2 weeks, but most likely within a week it will clear. Okay, and it is not dangerous. The other one, the pathologic jaundice, is if it builds up to a certain level, it could cause and lead to cerebral palsy. It could damage the brain.
Okay, that's where I was actually going to, because a lot of people say when jaundice are not properly treated in a child, it makes the child become vegetable much later in life.
Sort of, you're correct.
Okay, but then again, this jaundice, neonatal right now, so it is about the baby's formation, so before and maybe after birth. But so it's nothing to do with what the mother must have done or might have done during pregnancy.
And it's not genetic.
We can't really see. There are some other things that cause it. There's an enzyme issue. Some babies have what we call G6pd Deficiency, which can be triggered by several things, and mentholatum is part of them. There's what we call fava beans, that's part of it, though it's not common here. Then you also mentioned that the process of the delivery could cause it, you understand? And there's some people also who have this thing we call resource incompatibility, you understand? They tend to have this massively broken down red blood cells. The basic fact is from the mechanism I described, if for any reason the red blood cells that are not needed, which should have been broken down gradually, have a more rapid breakdown, maybe due to stress, infection, or some other immune system, that will cause a sudden burden on the new liver that it can't clear, and that will build up the jaundice. So there are certain things that could be, around the birth issue, or issues with incompatibility that could lead to such situations.
But it's not genetic, is it?
We can't really say it's genetic. We could say that some genetic factors present in the mother versus the child could lead to it, but it doesn't mean that it's genetic.
Okay.
All right. We still have our doctor here, and we have a pediatrician joining us from Ibadan. She is Dr. Bomi Busari. She's the senior registrar at the Department of Pediatrics at University College Hospital. To Adebowale here with us in the studio. I want to take it from where she stopped. What's with this thing about ultraviolet rays and the sun and jaundice? How do they correlate? I really don't get it.
Okay, it's been found out from research that ultraviolet rays breaks down bilirubin. Okay, making it easier for the liver to excrete them. That's what they do. Then, so it was an old practice in which you tell parents that expose the child to sunlight, not direct sunlight, but let them be.
That's another thing. How would you know what is much and what is less?
We don't have a measuring degree. We don't have like 10 sunlight, 20 sunlight, 30 sunlight degree measuring. So it's a big thing. But it's just a bit to allow people to, do this thing by themselves, which is not really the best. Most of these things are best done under a medical supervisor. Most people cannot even identify the tinge of a yellow skin jaundice. I can tell you there's been a pattern that you see somebody goes for a naming ceremony and sees the baby and raises alarm right there and then that, oh, this baby is really, really jaundice, you need to go to the hospital. So they usually present after the 8th day. And by then the jaundice level could be so high, like I said, that you might have to just do an exchange. You can't be waiting for light to do the breakdown for you anymore. You might have to do an exchange blood transfusion to save the baby from a permanent damage of the brain. So yeah, so that's like an emergency procedure you need to do, so that because that thing keeps rising high. And from the history, the medical personnel will be able to identify the most likely cause of jaundice in that child.
Okay, I'd like us to look at the case of antenatal, but before then, when a child is probably treated now, is there, do we see, or how do I put it now, would this, after being treated and the child has been confirmed well, in future, would there be a recurrence, or would the child be as normal as every other child?
No, we need to take this thing from the fact of first of all, the child, if there's no brain damage, the child will be like every other normal child. Okay. One of the important things that we tend to tell people to identify in a child with severe jaundice is that the level of activity of that child will diminish. The child may not be a child that was sucking day 1, day 2, day 3, maybe day 7, day 8, child is not sucking anymore. You try to hold the baby's hand, the child cannot grasp your hand the way they did before. So in a jaundice child, which already showing those signs, those symptoms already, it's relatively a sign of danger that this thing is getting to the brain and is depressing the baby's activity. You understand? So those are the things that we tell people to watch out for. Then when you are able to know the cause, then you can treat it permanently. For example, if during antenatal, we can identify the woman's resus status and most likely the baby, then we ask for the history. The woman might have to be immunized against the next pregnancy. If she didn't take it before and she had a delivery and an abortion before, that baby might be at risk. So a proper antenatal screening will save all such issues. We look at the delivery situation. Was it a normal delivery? Was it a stressful delivery? Did the baby cry immediately after birth? Did the baby not cry? How was the cord taken care of? Because that is a source of infection for a newborn. Then when you leave all those issues, we now have to look at, okay, was it a G6pd situation? In fact, in some cases, there's what we call breast milk jaundice. It's not much, but it does occur. That the triggering factor is actually the fact that the mother breastfeeds. You understand? Yes.
Share breastfeeding.
Yeah, it's not common, but in most cases you try to pick it from the history that this might be. When you rule out every other thing, you might want to look at, okay, is there a possibility that is breast milk jaundice? So, for example, if a baby was reacting to camphor or mentholatum, baby was fine, they left after 48 hours, and they came back within a week with severe jaundice, and we treat them, and they go back again and continue doing the same thing, they're going to come back again.
But then again, so it's not that you mentioned it now, so let's just get it very clearly. Using all of those stuff, are they really very dangerous to the health of new babies? The methylatum that you talked about, and using camphors.
Now, first of all, people use camphor to preserve clothes and all. We don't advise that they do so
for babies.
I don't even advise pregnant women or newly delivered mothers to use strong perfumes, because you use a strong perfume and you strap baby to your back. The babies might be asthmatic, breathing might become an issue. So we don't want any strong smell around those babies. Now, the use of mentholatum, we try and tell people it's a risk-benefit issue. You can do without using mentholatum. I don't they feel that it keeps the leg cold or warm. I don't know the benefit in that. They believe, they say cold will enter the chest. It will rub it in the chest. Oh, the legs and hands are cold. Instead of wrapping the baby properly and covering the baby with clothes, that alone can keep a child warm. Okay. You understand? And there's no way hair will enter through the chest. Air will enter only through the nostril and the mouth.
All right. A lot of questions are being asked here, but we're going to take them. Just to remind you that you can always still send your message or messages on the numbers now scrolling on your screen, or interact with us using the hashtag Galaxy Today on our various social media platforms. Please don't call this number, just send SMSs and then we will react to them. A lot of questions have been asked. Before we move to other types of jaundice, this one is asking if jaundice, let me see if I can paraphrase. She said something about can jaundice cause a delay in speech of a growing child that is not being able to talk on time? That's one. And the second one is jaundice caused by malaria in mother's body when if she failed to treat it during pregnancy? And okay, so I said she just started later. She wants to find out what could be the cause, and but just listen, I would react to your question, but just respond to those ones that I just asked now.
Okay, the first question has to do with the speech pattern. Now, if jaundice gets so high, as Dr. Busari has said, and you have a value of 25, 30 and above, or you have signs that the baby's brain has been damaged, if you have such a situation, you have the entire milestone delayed. The first thing you expect a child is that possibly the child can hold up his head by himself. You understand? I can expect that maybe by 9 months, the child should hold the head up when you're carrying the child. That will not occur. So the speech issue is still far away. You expect that child to sit by him or herself. That will not occur on time. So you have all this delayed issue in which you have to eventually be involving a physiotherapist, and you have to go through treatment and all for that child. So it's not just about the speech. Normally, developmental milestones vary from child to child. But there's a normal range, and when it goes beyond a certain point, you know that this is not a normal range. So you have all the milestones delayed in children who have had connecteros, a situation where jaundice has affected their brain.
You say, is jaundice seen on the eyes alone? And this one is asking, you talked about mentholatum and camphor. She's asking for alternatives. She can produce heat for the baby using charcoal.
Okay, charcoal in hot charcoal or just black charcoal. The fact is this: we want to keep the baby warm. We want to wrap the baby properly. That is, I think, the most thing you can do to keep a baby warm. Wrap a baby properly. That is the best you can do. Okay. You understand? In some places they try to use warm lights, halogen light that create light. But the best thing you could do for that child.
They even turn off the fans and the air conditioning in the house.
Not necessarily. Okay. Not necessarily. The first thing is keep the child well clothed, well covered. That is the first thing you need to do. You must realize that every human being creates heat. Okay. You understand? So if a child is well covered, the heat will not dissipate. The heat will, will stay in it. So it's not you creating the heat for the child.
Okay. Well, we have more questions, but let's take a quick break, and we'll be right back. It's still Galaxy Today. All right, welcome back. It's still Galaxy Today, and I must say that we have lots of questions, lots of people asking different questions as regards jaundice and related, symptoms. We still have Dr. Adebo Wale with us here in the studios. Just before the break, or during the break, we were pre-chatting about lots of myths, regarding this jaundice. And he said something about a lot of people say if you use a yellow shawl or yellow clothing for your babies, that you might end up, giving your baby jaundice. Let's just talk about this myth, please. Now,
people have their own belief about what can treat jaundice or what causes jaundice. You know, I've heard, and you know, the birth of a child is not a husband and wife affair. It's the extended family affair. The mother-in-law, the paternal mother might be the final decision maker. If they say they are going to hospital, they are going. If they say they are not going to hospital, nobody's going to the hospital. And I've had cases of people talking about, oh, the wife wasn't serious, the mother wasn't serious. We are told that don't buy yellow clothes, don't buy yellow show. And they've indicted that they've used pawpaw water, which is most likely not sterile, which is most likely even going to worsen the child's condition because it will be a source of infection because it wasn't boiled or processed. Okay. You heard issues of people using antibiotics. Antibiotics can only be successful if infection was the cause of the jaundice. But if it was not the cause of the jaundice, it has no role to play.
Okay, but this brings me to the part of antenatal. I mean, I believe women go for antenatal and these things are discussed, aren't they?
Well, they are discussed, but maybe if you had done the antenatal with the mother-in-laws and the husbands there, maybe you'd have gotten better results. The wife at that point in time is still on the bed. The mother is still on the bed. She's not primarily the decision maker. She would, if she had had a cesarean section, she might even not really know what's even going on much around her, or even have a say. So she's not the primary caregiver to the newborn immediately after birth. Somebody's there to help her, and those are the people that we need to really talk to.
Okay. Well, this one is asking, she says, can jaundice cause a 10-day-old baby inability to excrete? That's one. So can jaundice in a newborn baby be transmitted, can transmit to SS? Now, this is not related. Lots of questions. Okay, this one wants to find out if glucose and sunlight cannot cure jaundice.
Glucose is just to feed a baby in the immediate hours after birth. It's not even a good substitute for feed because it's just glucose. It doesn't have all the things the baby requires. It's not as good as breast milk or even as good as formula. It's just if perhaps you had a baby and you realize that the baby's blood sugar was very, very low after birth, especially big babies, you can institute that in the first 3 to 6 hours. Beyond that, it doesn't really have any control on jaundice.
Okay. I don't know if that's the questions on babies. I'd like us to look at it from the adults angle now. A whole lot of people think that jaundice only affects children, but it also affects adults.
Yes, a lot of adults. Someone mentioned something about sickle cell. Sickle cell too they appear with jaundice a lot.
Okay, yeah.
They appear with jaundice a lot because, like I said, it has to do with the blood cells being broken down and the liver being able to process it. Most of the time, any disease involving the liver, hepatitis, cancer, liver failure, liver cirrhosis, or something impinging on a gallbladder outlet, all those issues can lead to the manifestation of jaundice in an adult. So it's usually a symptom of an underlying problem. The causes can be as much as 30 to 40 causes of what manifest as jaundice physically. So it's a really wide, the cause range is very, very wide. So investigations are usually very extensive. Ultrasound scan, CT scan, blood tests, even have to do with autoimmune issues to actually identify the cause of the jaundice in the adult.
Okay, this one is asking, I think it's actually another popular myth that if a baby is diagnosed with jaundice, that if not taken care of, it could die in 4 days.
Well, the death is almost every issue. Malaria can cause death, so many things can cause death. Like I said, it's depressing the brain, and if it depresses the brain to the point that respiration is depressed, there's nothing much you can do. But even if it doesn't get to that point, we have serious issues because a baby having a permanent damage is it's a permanent burden on the parents. Whereas I've seen parents coping with such issues. It's not funny. It's not funny at all, and it's something that you have something little becomes something major when you don't avoid it. That's how it is.
This one is related. It's also asking, is jaundice is a cause of sudden death syndrome in babies?
No, it is not. Okay. It's a process. It won't lead to that suddenly. Okay. But like I said, anything that suppresses the brain, it's something you would have seen. Most likely it was seen, it was ignored, and it led to death. A lot of sudden death incidents do not even have jaundice at all.
Okay.
So it could be something else entirely.
Exactly.
Okay, I'd like us to look at it from the preventive level now. I mean, when are you supposed to seek medical help when you see that when one notices that his or her child has these symptoms?
Okay, now
Then to add to that, sorry, specifically, someone is saying that all her babies, that she's had jaundice.
Yes, it's possible. All the babies could have physiologic jaundice.
Okay.
And physiologic jaundice will resolve on its own. And all the babies could have pathologic jaundice that was mild, and she had phototherapy in all cases. And they all became okay. But the first thing every mother has to do, first of all, deliver in a place where they are experienced, a proper health facility, where there's experience, where the people can identify from the skin, even before the baby, that the baby is jaundiced. Some can even identify the level of intensity. They can examine the baby properly. In some cases, we can even preempt the treatment. If you know that the baby had a difficult delivery or the baby was premature, you could even preempt by even instituting certain things. Like in premature babies, you place them under phototherapy light even before the jaundice shows up. So you can even preempt in certain cases. If you suspect that, oh, this baby would most likely have an infection or baby was referred, you preempt those things from occurring before you actually deal with them. So that has to be there. Then there's also a need for follow-up. If this was mild jaundice, like I said earlier, jaundice within the first 24 hours is most likely pathologic. Now, even if it showed up later and you saw a doctor, they'll tell you what to do. Let's run some tests. Let's observe. Please come back within the following day. Let's see if this thing is rising or it's going down. You understand? So all the observation period, if not ignored, will lead to an easy resolution of the problem. But if it's a case in which nobody even knew what was going on and it was just a stranger that just came on the naming ceremony to tell them that no, this is serious, or the mother just realized that, oh, baby was sucking before, baby wasn't sucking again, baby used to grasp my hand, it wasn't happening again, baby is now dull than before. We don't need to wait for those symptoms before we begin to take action.
Okay, this one is asking, he says his brother's eyes, I'll try and paraphrase, he says that his brother's eyes have never been clear, as in they've always been yellow, but he's doing well in school. That he was asking if it's still related to jaundice.
His brother is not a baby. His brother is an adult. And sickle cell people, I won't call them patients, sickle cell people sometimes tend to have a yellow eye sclera more often than not. Some it will go, some keep reoccurring, some it gets intense. But it's not something that you would sit back and watch. Then you will always like to follow up on them and stuff like that.
Okay, so I'd like us to go back to what Dr. Bumibo Busari said about one's resox factor and the genotype now. So are you saying that not just it's just a woman's resox factor or genotype that can actually affect, because she did say something that if the baby's genotype is not compatible with that of the mother, how about the baby to the father? Are there cases like that?
Okay, let me bring it up again. Now, when you say O positive, A positive, B positive, B negative, O negative, O positive, the positive and negative in those blood groups are actually referring to the resource factor. The baby always takes after the father.
Okay.
That is a fact.
Always.
Yes, the baby takes after the father. So if I was negative and my wife was positive, my baby will be negative.
Okay.
Now, for the first baby, there's no problem. If that is the first baby, first conception, there's no problem. However, that first baby would leave certain triggers behind in the mother, in which the mother will produce antibodies against. You understand? So the next pregnancy, the antibodies will now come up again, looking at the baby like a foreign object, and will attack the baby, which basically attacks the red blood cell, which you call jaundice in that child. And that is the reason why in those cases, when we have this incompatibility, you understand, especially when the mother is negative, if the mother is negative, in all cases we want them to take some injections that will, suppress that antibody from coming up. So it's most likely when you do antenatal and you realize that the mother is negative, you will want to immunize the mother or prevent the mother from having such issues again.
Okay, so
but if the mother is positive and baby is negative, we really don't have any problem in that regard. Problem usually occurs when the mother is negative and the baby is on the other side of it.
Okay. Okay. So even if they're twins, as long as it's the first conception.
Yes, as long as the first conception, there's no problem. But after that first conception, the mother has to be immunized or given an injection after birth that will prevent those things from coming up, and that will save the next baby, maybe 2 years down the line.
Wow.